people, I'm Petar and I've agreed to document my journey to Istanbul, Turkey. Okay, so just arrived at Stansted. About to get myself checked in. That should be interesting. Never checked in with Kiwi before, so we'll see what happens. Just got on the plane, about to board. Okay, so an update. I'm kind of cut ahead and we're in the hotel now. Here's the bed. I got some blood taken, as you can see here. You can see very nice place. So I just arrived at the Liv Hospital again. Dr. Junaid.
Yes, welcome. It's nice to meet you.
Nice to meet you.
And
as well.
we made our examination with Doppler device.
Yep.
Here is our Doppler device in the hospital. And yeah, we see the large veins. In the right side especially,
Yes.
they couldn't operate it because they were unable to reach the right side.
Catheter could not
There's a
reach.
big vein in the right side and also some remaining, again, big veins in the left side too. We will do both of them in a couple of hours. Now you will go for the hospitalization to reservation list. Okay, see you guys.
Thank you.
Hello friends, today we prepared a video for you about our varicocele procedure, about Istanbul varicocelectomy technique, and we try to show you how it works for a patient coming from another country, what's his experiences. So thanks Peter that he shared his experience with us. He recorded self-videos from his travel from home in UK and coming here to Istanbul for this surgery, and he shared with us the experiences in Liv Hospital and his room after the operation. It's a little bit long video. In some part I've shared with you the informed consent of a varicocele procedure. You will see the details, how we concern about the complications of the procedure and how we get consent from the patient, and you will see the risks of the procedure. He has a previous embolization, as most of our patients unfortunately have, and after the embolization we were showing what we find in the operation, how we dissected a very long segment of external vein. And I always say that embolization is a very nice procedure, but unfortunately it has no capacity to reach the external and gubernacular veins in the testicle, around the testicle. So open procedure, microscopic procedure is still must be the first choice. So he is one of our patients. This year we operated maybe like 10 cases of embolization recurrence, embolization failure. I believe and trust in embolization is very good option for some selected cases. It's possible to understand with ultrasonography before the procedure if this guy has external vein or not. We can roughly say if the veins, dilated veins, pumpiniform plexus is located above the testicle, these are mostly internal veins. But if they are around the testicle, below the testicle, these must be external veins. So embolization is not working good for these guys who have external and gubernacular veins dilated. And unfortunately, he had also right-sided varicocele, and they tried to go from the jugular vein, not from the into iliac veins, because with iliac veins it's not possible to reach the right side, but with jugular vein you can go both the left and right side, but they couldn't reach the right-sided veins because of some technical reason. So this is another weak point of the embolization. It's not easy to access the right side, so they couldn't operate the right side, and they said, okay, the right side is not so much important. But he had pain in the left and right side continuing after the procedure. So he found us. We made an online consultation with him first. And these online consultations, I really recommend everyone who is planning to do this surgery, who is planning to come for this surgery, to have an online consultation first. Because people usually send me some test results and ask me, do you think we need operation or not? It's not possible to say to make a comment like this. It's not possible, and it is really dangerous to make a diagnosis overseas with internet, just with some pictures. So when I talk to my patients face to face with such a video talk from WhatsApp video or such an environment, we understand each other better. I see their results live, and we can comment more easily. Of course, it is not enough without seeing a patient to make a diagnosis. So I usually obey the diagnosis of a doctor in his country, and if they have a indication for operation, I accept this patient. I usually do not do diagnosis from internet. I just accept the diagnosis of another doctor. So in this video, it's a long video. Please, if you are really interested in this subject, see it and watch it, and you will see his visit just going out from his home and in the airport and traveling and coming here, meeting me first time, making the first examination, then giving informed consent to him in his room, and then the procedure. After the procedure, our talks, and after the procedure, our control visit in my office. This is how we do our Istanbul varicocelectomy for the patients coming from abroad. Have a nice day. See the video.
Hello guys, so I signed some extra paperwork after the Doppler ultrasonography, and I've been kitted up in the hospital gown.
Hello.
Hello.
Hi, my friend.
Hello, how are you?
Welcome again.
Thanks again.
How are you?
I'm great.
Excited?
What about you?
Nervous.
Great. Well, not
So,
nervous.
the previous operation a little bit longer, it last long, no
What
problem.
was it, the bladder tumor?
It was a bladder cancer, young guy. The professor, Dr. Karadeniz, I'm working with, he is mainly dealing with these bladder cancers. We are making new bladder from the intestine. It's a very long operation, but today it finished now.
Yeah.
So, how did you find the hospital? Is it
Good, yeah, everything perfect, no complaints. In fact, it's really good. I love the hospital. Like, it looks very nice. The staff have been very kind, so everything 10 out of 10.
So now, maybe in 30 minutes, we will take you to procedure.
Yeah.
Do you have any questions? Do you have any concerns? Anything you want to ask before the procedure?
Yeah, actually, I was wondering. I like to do sport and sometimes to lift weights.
Yeah.
And I've heard that straining while lifting can affect the varicocele, and I'm just wondering, after the procedure, is there any advice that you would give me or something like that?
Very good question, thank you.
Yeah.
It does not have a standard answer. For every patient, I look after the procedure with Doppler device and check how much vein is inside, how much vein there is residual. Sometimes we can take out a very big segment of the vein. Sometimes it is divided into branches too early, and we can only take out a smaller part, and this divided part has to stay inside and disappear itself. So after the procedure, before you leave, I will check the veins. And make you strain, make you simulate the exercise that you will do. If I see too much veins, I will say do not do sports 3 months. Unfortunately, I am saying this to maybe 50% of my patients. And especially if the guy is someone who is doing too much sports and weightlifting, I really want him to stop at least for 3 months and go for swimming. And it will not be extreme.
Oh, so cardiovascular load is okay, but straining no.
I don't want intra-abdominal pressure to increase. This Valsalva maneuver is harmful for us. So even if I will see perfect after the procedure, still I will say do not do it for 1 month, maybe longer. So in my patients in Istanbul, it's very easy. They come after 1 month, after 3 months. They come frequently. But for you, if someone is unable to come here again, which most of my patients from abroad is like this, I want them to do a Doppler ultrasonography at 4th month. If they want to do sports,
if they want to conceive a child as soon as possible, 4 months. If he is single, not too much care about the baby, so I want them to do it at 6 months. 6 months is a better time for healing, but usually around 4 months we do the sperm count and this test. So we will understand it after the procedure with Doppler control. I can't say beforehand you can do it or not, but most of the patients cannot do it for 1 month, sports. Some of them for 3 months.
I see. Okay, so it depends on how the venous structure down there is.
After the procedure.
Okay.
And sometimes during the procedure I can understand if there is very large veins, I want to be careful, cautious. Yeah, we will make you sign an informed consent. In these consents we talk about every side effect, every bad thing can happen. And okay, you can read, but here the most important part: complications of the procedure.
Right.
So after the operation, fluid collection. This is hydrocele may develop in scrotum.
I see.
This is it is mostly written 10%, and everybody scares about it. But in my cases, in microscopic procedure, it is around in the literature 1%, 1.5%. I never seen in my cases a hydrocele.
Yeah.
But still, we must inform you.
Yeah.
Injury or ligation of the testicular artery. This is the most important part. You have varicocele embolization before, and recurrence. Unfortunately, it recurred.
Yeah.
And it was 7 months before. In embolization, the best thing, they can never have any intervention to artery because they go from the jugular vein, and they can't give any harm to artery because they are inside the vein.
Right.
But in our operation, we will see the vessels like this, and we will look each of them if it is artery or vein.
With the intraoperative Doppler.
Yes, this device. Yeah, it's very useful in these operations. We use it and check every vessel if it is an artery or vein. So this option is less. We don't have too much like this, but still we have to say like 1%.
Okay.
After surgical procedure, varicocele may recur, like your case. You had the procedure. On all of the varicocele operations, there may be a recurrence. This recurrence, for me, in my procedure, it is actually 3%, but you have once recurrence. So, when some patient has an embolization, the inner side is usually completely healed. So, but outer veins, they are very easy for me to treat. So this 3% may be low in your case, but still 1%, 2%.
Just to ask, how do you determine whether or not the inner veins are treated during the operation?
Yeah.
Okay.
So before the operation, when I looked with Doppler, there was no recurrence in the inner veins. Just the outer part was seemed to be. But I can't understand 100%, so I will look in the operation for this. Infection may develop in the incision area. Antibiotic treatment may be required. Really, I didn't see this. Maybe last 1,000 cases. And a temporary perinatal catheter may be required for urine drainage after the operation. If we do spinal anesthesia, anesthesia from here, we have to put a catheter in the bladder. But in your case, we will not do spinal. General anesthesia will be given, and it's very rare, nearly impossible to have this. Improvement in semen quality may not be at the expected level. Varicocele operation is done for 2 reasons mainly. If there is a decrease in the sperm count, or if there is too much pain, if there is a pain in the testicle. So we always aim to increase the sperm quality, but this increase may not be enough for your conceiving a child. So, but we have to do our best. You have to search for these therapies, and but after all of these, maybe 10% of our patients still may need some aided pregnancy techniques like IVF, like insemination. So. But you are now single, not married, you have time, so it will improve till you marry, I think. peritoneal injury may occur. This is in laparoscopic cases. This is not in our problem. It's not our problem. In some people, postoperative bleeding may develop. Additional intervention may be required. This is one of the most important problems we can have. There may be bleeding inside the scrotum, and it may, if there is a bleeding, for example, in here, this cannot increase too much in size because this is a tight area.
Yeah.
But scrotum is a very loose area. If there is a small bleeding, and in secondary cases like you, the percentage is higher, the possibility is higher. If there is bleeding, there will be hematoma inside the scrotum. No problem. It may need intervention, but we usually don't do any intervention. Just compress the scrotum. It's a compressible part of the body.
Yeah.
You can't stop bleeding in the liver by compressing your abdomen. In the heart, you can compress your heart, but scrotum, you can squeeze the testicles. It's a little painful, but we can do it. So we make you wear an underwear after the procedure.
Right. Yeah, compressible.
Yeah, to compress the testicles. But still, maybe in every not 20 cases, maybe in 50 or 100 cases, maybe we are facing this. I hope it will not happen.
Me too.
Yeah. And in some people, wound healing may be abnormal and one side may become thick. This is keloid.
No, I don't have. I had an appendicitis and
this is nice. No, normally we are expecting a simple line like this.
Yeah.
And it will be around 2.5 to 3 centimeters. Yeah. But some people, we see this keloid formation. It's really unexpected. We can give you some creams that the ladies use after cesarean operation. They use creams too much not to have these, but it's very rare. And overweight people, smokers at high risk terms, wound infection, chest infection, heart and lung complications. You are not overweight. Okay, these are the and side effects: pain, swelling in testicles, infection at the wound site. Yeah, it's very rare side effects. Shrinkage of the testicles. This is if the artery is cut.
Oh, I see.
There will be shrinkage in the testicle. Sperm structure functions remain the same or deteriorate. Spread infection into bloodstream. Yeah, these are not too much. So let me sign this. Today is 22?
22, yeah.
22, 12, 22. Very good.
The date, right?
Yeah. And please write here, I understand and agree to what I have read. Okay. Write here this. Yeah, and write your name.
Oh, okay.
Are you living in London?
In Kent, but yeah, sometimes in London.
Kent, yeah.
For half the week in London for work.
Yeah. Okay. So it's. How's UK now? How's the weather?
It was very cold.
Really?
Like a week ago or so, we had a stretch of like 5 days, which was it got down to -10 at one point.
Really?
Yeah, the snow was staying. But
Last weekend it was very cold here too. I get a call.
oh.
And date here, please.
22.
Do you put date like this in UK?
Sometimes with slashes, sometimes with dots.
No, in the United States they write like
month
December
first. Yeah.
22nd.
Yeah.
It's
No, it's like this in UK.
okay. We use the same.
I think how it should be in order of the length of the time period.
Yes, many things. Okay, so now we are downstairs. Prepare the operating room, and we'll call you down.
Perfect.
Okay, see you downstairs.
See you down.
But in the right side, there were long, maybe 110 centimeter, 115 centimeter. We had a lot of it. Totally, I think it's more than 60 centimeters.
Hello, Good morning. I've just had breakfast. It's the day after surgery today. It went really well. So I've just been dropped off at Vital Fulya Plaza, where Dr. Junaid Sevinch's office is supposed to be. We're gonna do some,
Okay, so yesterday evening your operation finished, right?
Yes.
Yesterday evening we started a little late because of the previous operation, and today we discharged you from the hospital, and I asked you to come to office for a control.
Yes.
And it's actually too early, but your schedule is a little quick. You will turn tomorrow. No, Sunday.
On Sunday, yeah.
Sunday, yeah. Okay, so let me see them now. So, now, this is left testis.
Yep.
We operated it yesterday.
Yes.
Now I am checking for the arterial pulsation inside the testicle. Yeah, we want to see these arteries. It is the most important part.
It wasn't like this before.
Yeah, this is nice now. Sometimes when there are too much veins, the pressure increases, and also artery has trouble to find way inside. And now look at the incision site. Okay, now we finished the operation.
Yes.
It happened yesterday.
Yep.
Yesterday afternoon, and today the first day post-operative first day. Of course, it is not easy, but it's tolerable. It is doable.
For sure.
You come for a control, and we checked your arteries. The testicles are okay. They are well supplied by arteries. And how do you feel after the operation?
Immediately after, or?
Yes, everything. Immediately after. How is now?
Well, now it's very good. The pain was slightly higher yesterday, right after the operation, but today I woke up and it was at a much more manageable level.
Yeah.
And throughout the day it kept on getting better and better. Now
I prescribed a painkiller and an antibiotic. You will use them regularly. Even if you have pain or not, use the painkiller, because it's also an anti-inflammatory. So it will decrease the inflammation in the healing. So if we show your operation, you had a varicocele embolization.
Yes.
Actually, you needed two-sided, but they could only reach to left-sided.
Yes.
This is the weak point, one of the weak points of embolization. It's not very easy to reach to right side. They changed the method. Before they were doing it from inguinal area. Now they are using jugular to go both sides.
Yeah.
But still, the right side, it's problem. It's not easy to access. But we controlled, and we see there were big veins in the right side, so we make a decision to operate both sides.
Yes.
And in the operation, I will show the videos now. Yeah, here we see again this external vein. Okay, very big vein. He can palpate this vein by himself. Throughout the day, it becomes larger. Okay, this is the spermatic cord. In the operation, when we cut this skin tissue, we find the sperm channel, and then here this is spermatic cord, and there is an external vein here. It's not possible to access this vein from the embolization route. It's outside the spermatic channel, and it turns in an earlier way, not go up with the others. So embolization cannot reach to this vein, and this vein stayed there and larger. In the inner side, I saw in the ultrasound the veins healed nicely, but of course I will open it and will control all of them under microscope. Okay, so now this is the external vein, and then we search for the gubernacular veins here. The gubernacular veins are not so large in this patient. Still, there is some gubernacular components here. They are not too large, but we will ligate them. This is gubernacular. This is the place. The testis is attached to scrotal skin, and sometimes there are too many veins here. But in this patient, see that
This is not a very.
This is a gubernacular vein.
Yeah.
We also ligated it. Then we pass to a external vein. Look at this. This is a really huge vein. We dissected it step by step.
Vein. Yeah, I think it's not needed to. Okay, now you see there. This is, I think, this is 15
Like
centimeters.
25
here.
centimeters.
Like 25 centimeters of vein. We are excising, and we will look for the others.
Now,
Here, we pass to the second stage of our procedure, which is we use.
so the first part is not microscopic. It is seen from outside.
Yeah.
It's easily seen. But the veins are next to arteries. So we have to separate them. We need the microscope in that stage.
And the pool.
Still, with the microscope, you can see the pulsation of the artery every time. Sometimes it pulsates, like here one artery is pulsating.
Yeah.
There are 4 vessels, they all look like each other. Sometimes this is not pulsating. So they are all silent. Which one is artery? You will never know. But microvascular Doppler shows it better. So in this part we use the microscope.
The microscope and this microvascular Doppler. I hope on embolization worked nicely.
Look, here we can't see any pulsation now, but I know it is under that tissue. We didn't open yet. It's closed now. It has an envelope.
Yeah.
So I know where not to open, where the artery will be placed.
Yeah.
So
Here, but of course I already controlled.
this is artery.
I understand my artery is here.
This sound.
Unfortunately, this sound shows me there is a venous leakage here. So now we will investigate this.
Yeah. When I see this sound, this means there is varicocele.
I see.
So I was not expecting to see any internal varicose veins, but when I see this sound, I said, okay, there must be something wrong.
Yeah.
So we of course, in any way, we would open this, but we said, okay, now we have to open this, and when we open, of course, again, with microscope, we are looking.
Unfortunately, there is some.
And then change it here.
I can.
Şey mi yapacağız? Keseriz onu.
This side, you open the right side now.
Çekiyor
This is
musun?
left side in the seat.
Okay, now I opened the left side, and there's a longer video, and we find big vessels in the left side. I don't know where it is, maybe this part.
Yeah, very nice.
No, I think it's
This
so-
side, you open the right side now. This is left side incision. And here, he has
This
a
is
long
external vein of
varicocele
the
disease.
right side.
And we can see the vessel. He isn't operated, although they for itself here. And when we look at
And there
the
are some
gubernacular vein,
gubernacular veins.
there is a gubernacular vein. Oh, it's a little larger.
Here is a large
These are
gubernacular vein.
gubernacular veins.
Yeah.
I think
So we
can
decided to take
these-
it out.
these veins.
And we
time
find
is not
more.
enough for these gubernacular veins.
More gubernacular veins here. So we said, okay, just in the left side we only tied it, but look at this. There are 3 big gubernacular veins, and we dissected the external vein like this.
Wow.
So after that, we pass to second stage.
To test this in, take the microscope to operation field, and we will look for the internal veins. Here we see the artery, and here there is
This
a
is
large
right side.
vein that you see.
Look at the large veins. These are really large.
Vein segment here, and here one more large vein. There is a small vein.
on the right side.
Right side. Yeah, they couldn't operate this part, but it really needs surgery.
Embolization couldn't reach that part, and they injected this part. So now we are going with this part first. We do the one which is far away from.
Look at this.
Here, this vein has no communication with the artery, so we will first.
One of the veins is very easy to dissect. Fortunately, this is the largest vein, and it is not next to artery. You can easily separate it.
Yeah.
But also the other veins, let us take them out easily.
Just navigate this as in conventional procedures, or we will take out, as you see now. There's a huge.
Our microscope is very nice.
It's
You see that?
Yeah.
not very difficult.
Let me see the other video. Look at this view. These are special clipses. These are really easing my job.
Yeah.
I don't use them too much, just in the needed parts, and I don't put them to lower parts. You can't feel them in the scrotum.
Are they platinum clips?
Yes. Look, I
will continue.
make the naked.
You can see there is no artery because the vein becomes naked.
When you rip it like this, you can see there is no artery. This is artery.
Yeah.
Am I sure? Yes, I am sure this is artery, but always control is better. So the microvascular Doppler proves, okay, I am in the right path, this is vein, and artery is here.
Very nice to use them.
So, this is the procedure. We first excise the external veins, tubercular veins,
Yeah.
then take the microscope in, and with the microscope find these vessels, see them, and with the Doppler device we separate the arteries. You had embolization, and fortunately it recurred. Is this procedure have any chance to recur? Very less, very less.
Yeah.
I don't want you to do any Valsalva maneuver, stressful weightlifting exercises for at least 3 months.
Okay.
After 1 month, the healing will be better, and you will start using some supplements. For 3 months, you will use supplements. This will aid the healing process.
See.
And then I will ask you to send me a Doppler and Doppler ultrasonography and a sperm count. If you have any chance to come here again,
Yeah.
we would like to see you again and do this by ourselves, or sperm count here, of course.
Yeah.
But you can send them to us from England if it is easy to do there.
It is probably easier and in fact cheaper to do here, especially if I book plane tickets in advance. It would be better. I can do that.
Maybe. Yeah, it's easier to make control again. Of course, it will be better.
Yeah.
And in that period, don't be constipated. Don't weight heavy lifts. Live a normal life, healthy life.
Yeah.
And don't smoke if you can, or a very small amount.
Yeah.
Other than this, live your normal life. Do not do extreme sports. For if someone is professional sportsman, we say okay, 1 month do nothing. Then after you can start. You have to start. But we make frequent controls. Our recurrence rate is very low. Maybe 3%, around 3%, but in your case, we are definitely take out everything.
Yeah.
And you had also embolization, sure worked, it did something. Your right side was more than, bigger, the veins were bigger than the left side.
Yeah.
So in left, but also in left side there were veins. Thank you for coming.
Thanks for having me. It's been a pleasure. It's been great. I couldn't thank you more.
Thank you, really. And what's your comments about Turkey, about this trip?
Well, good. Like if you can come here and get this done, especially with Dr. Junaid Sevinch, he's your guy. Like through all my research, I found that there's not really a more superior technique when it comes to lowering recurrence rate and general success of the operation. Post-operative pain is minimal as well, so especially considering the price, if you can get here and have it done, go for it by all means. That's my opinion.
Thank you.
Hızlı
Thank
iletişime
you.
geçebiliriz hocam.
Really, I was having the same. I was thinking I'm doing the same way. The results must be the same as everyone.
Yeah.
But then when people begin to come to me more and more, the experience is something different. Normally, a urology doctor operates 2 cases a month, but we operate like 20 cases every month, maybe more, and most of them, maybe half of them from abroad. And we now understand and learn how to deal with cases from abroad. And Turkey is kind of cheaply nowadays compared to other countries. And how did you first time find me?
I was actually watching videos on YouTube about just microsurgical varicocelectomy.
Because you had the embolization, now you were searching for the microsurgery.
Exactly, yeah. I was still having pains, symptoms of hormonal disbalances. It was nasty. So I was looking at these videos.
How was the pain?
The pain, it's dull ache, small dull ache. Almost not noticeable, but it's definitely there.
And can you palpate the veins? Can you feel the veins in your scrotum?
Now, probably no, but before, yes, definitely, definitely. So yeah, I was watching your videos on YouTube, and in one of the procedures I noticed that you're actually dissecting the vein out itself. So having seen that, I never saw it in any other video. And after you explained the theory behind it and how taking out the vein itself quickens the healing process and also decreases the chance of a recurrence. I did not find this technique anywhere else using it, so I decided that I would contact you, see how I can get this done. In the meantime, when I was in Liège and with your assistant, I did watch more of your videos and got on a telephone consultation.
And we have a consultation before. These consultations are important really, because sometimes people send me 10 papers of results and say, do I need operation? It's really not easy to look at them and yes, you must be operated or not. And 10 days later, he sends one more result. What do you think about it? Oops, who was you? What was your old results? So every time I forget everything, complete zero in my mind. Then I have to discuss it with the patient. Like now we are here face to face, and we consulted face to face from the WhatsApp video, and of course we charged for it because I have to spare some time.
Of course, yes.
And this is fair, you can say, 100%. Right? Yes, so we understand each other. I understand and believe that you know what's your situation, and because sometimes people can mistakenly come. They can say, oh, I have varicocele, but maybe they are not. So when I talk to them, I understand, okay, this guy needs the surgery. So I don't want anyone to come here for nothing.
Yes.
So I become confident that you know your situation well, you have you had the procedure before, you have your results, so we call you, you come and we see the vessels, we did the operation. I am happy, thank you very much for coming. Thank you for everything, and have a nice life forever without this varicocele disease anymore.
So guys, if you finished watching, this is our technique. We do many cases from abroad. It's possible to come from abroad and do the procedure here. Varicocelectomy is not a very difficult procedure, but we have a special technique and we are trying to improve the quality of the procedure, the success rate of the procedure, and decrease the recurrence rate of the procedure. People ask me why you are just doing it, nobody is doing it. Because varicocele is my main interest. I do maybe 90% of my operations is varicocele surgery nowadays, and I use my own Doppler device, Doppler ultrasonography, before the procedure. I check the veins, I see the veins, And unfortunately, I noticed that with conventional operations, which I was doing before like that, it's not enough. The veins are still there after the procedure and they are not going away. We have to do something else. Why other urologists are not aware of this? Because they are not using the Doppler device. They send the patients to radiologists for the diagnosis and after the procedure for follow-up. And they don't send the patient immediately after the procedure. But I do Doppler before and after the procedure immediately, and I noticed that the veins are still there after the procedure, so we had to change the procedure. So we changed the procedure and we are very happy with the results. And maybe most of our experience is nowadays recurrent cases. Recurrence after embolization, recurrence after normal conventional varicocelectomy, recurrence after microscopic surgery. So in these recurrent cases, I see many times the veins are very nicely ligated. All of the veins sometimes. The doctors did what they have to do, but the veins did not disappear in some cases. We don't know why, we don't know how, but the ligated veins are still there. I see the ligation, I see the ligature on the vein, but the vein is still there. The continuous flow is continuing in this vein, so we take them out. People ask me, is it possible to come from another country and stay there and go back? Yes, it's possible. We are doing it. I recommend everyone first to have an online consultation to understand each other. Then when they come, spare like 6 days at least, maybe 7 here. And the first day is for travel, second day is for preparations, and third day for operation. Then rest for a couple of days, and at the end of the week, like Friday, we make a last control, and then Saturday the patient can fly back home. So to summarize again, I recommend Sunday for travel and Monday for preparations, Tuesday for operation, Wednesday and Thursday for rest, Friday for control visit, and Saturday fly back to your home. It's possible, it's doable. We are doing it to many patients, and Turkey is nowadays a little cheaper compared to other countries because of the currency rates. And yeah, it's really a good opportunity to have the procedure here, and it's possible, it's doable. Thank you very much for watching. Bye bye.